Good morning everyone. Myself Dr. Vishwa Raj Lal, Faculty of Biotechnology, Jamshedpur Women's College, Jamshedpur. In previous classes, we have discussed about the heart. In this heart, we discuss about the introductions, anatomy of the heart, layers of the heart wall, chambers of the heart valves and circulations of blood, systematic and pulmonary circulations, cardiac muscles, tissues and the cardiac conduction systems, electrical stimulations, and today we will discuss about heartbeat, regulations of heartbeat and cardiac cycle. So we start heartbeat. It is the spontaneous rhythmic contractions and relaxations of the heart to pump out and receive blood to and from the body. Heartbeat are of two types, neurogenic and myogenic. On the basis of this, heart is differentiated into two types, neurogenic and myogenic. Regulations of heartbeats. Heartbeats at a fixed rate due to inherent property of the fibers of SA node, but it can also be controlled by nervous and hormonal mechanisms. Nervous regulations. Center of heartbeat regulations in brain is medulla oblongata. Sympathetic nervous systems having accelerator nerve increase the heartbeat of secreting adrenaline hormones, whereas parasympathetic nervous systems supplying with vagus nerves decreasing the heartbeat by secreting acetylcholine. Normal regulations. In hormonal regulations, thyroxine secreted by thyroid gland increases heartbeat indirectly by increasing basal's metabolic rate, which requires more oxygen. Epinephrine and non-epinephrine secreted by adrenal medulla also have a role in regulations. Epinephrine increases heartbeat in emergency, whereas epinephrine increases heartbeat under normal conditions. So non-epinephrine increases heartbeats under normal conditions. Next, cardiac cycles. The cycle of event which occur in single heartbeat is called cardiac cycle. It involves repeated contractions and relaxations of the heart muscles. Contractions when blood is injected from the heart is called systole, and relaxations when the chambers of the heart are filled with blood is called diastole. The heart is said to be in a state of joint diastole when all its four chambers are in relaxed state. A cardiac cycle takes about 0.8 seconds and is completed in the following phases. First, isometric relaxations. Second, atrial diastole. Third, ventricular systole. And fourth, ventricular diastole. So starting isometric relaxations. This is the first phase when all the valves are closed and the atria and ventricles are relaxed. In atrial diastole, both the atrial filled with blood having deoxygenated in right and oxygenated in left. When the atria and ventricles are both relaxed. At first, the bicuspid and tricuspid valves are closed, but as the atria get filled with blood, their increased pressures eventually becomes greater than that in the relaxed ventricles, and the AV valves are pushed open. The SL valves remain closed. This phase is also known as the rapid filling phase. The blood flow into the heart then ceases as the pressure in the heart equals to that in the veins. supplying it. There is then a brief period of diastole where there is no movement of blood at all. At the end of this phase, the two atria contract simultaneously and result in the blood being pumped into ventricles. This is called atrial systole. Next, ventricles systole. When the contractions of ventricles occurs immediately after atrial systole, the pressure in the ventricles rises and closes the atrioventricular valve, preventing blood from returning into the atria. Then the pressure forces to open the similar valves of aorta and pulmonary artery to make entry of the blood into these vessels. The closing of atrioventricular valves during ventricular systole produce the first heart sound lump. Lastly, ventricular diastole. During this, the semilunar valves are closed because of the blood forced back into the ventricles due to high pressure developed in the vessels. This causes the second heart sound dump, D-U-P-P, dump. Next we discuss about blood pressure. It is the atrial pressure of the blood excreted on the wall of arteries which each heartbeat. The blood pressures can be measured by sphygmomanometer. Blood pressure is expressed as systolic pressure mmHg divided by diastolic pressures mm/Hg. Normal blood pressure has high systolic valves and low diastolic valves, that is 120 mmHg by 80 mmHg in arteries. Systolic pressure is higher because of increased pressure in arteries. Next, cardiac output. The amount of blood flowing from the heart over a given period of time is known as cardiac output. So the units of measurement are millimeters of mercury. For example, 120 mmHg per 80 mmHg is considered to be normal blood pressure. The total number is referred to as the systolic pressure. The bottom number is the diastolic pressure. Okay, thank you. This is all about heart. So in heart we have all discussed about the introductions, anatomy of the heart, layers of the heart wall, chambers of the heart valves and circulations blood, systematic and pulmonary circulations, cardiac muscles, tissues and the cardiac conduction system, electrical stimulations, heartbeat, regulation of heartbeat, nervous regulations, hormonal regulations, and lastly cardiac cycles, isometric relaxation, atrial diastole, ventricular systole, ventricular diastole. So this is all about heart. Thank you.